Good morning, and thanks for waking up with us. On today's episode, we are sitting down with General Surgeon Dr. Robert McDevitt to talk about colon cancer. You'll also hear from a colon cancer survivor who has agreed to share his story in an effort to reach others to take action before it's too late.
Well, my name is Steve Meyer. This is my story about my journey through cancer, colon cancer. The journey started about 7 years ago, probably. Started just kind of out of the blue, I guess, with a colon test kit showing up in the mail. You don't get a lot of those in the mail, but I went ahead and completed it, sent it in, and that was probably in the fall of 2012. By January, the test kit came back positive. At that point, I immediately scheduled a colonoscopy. I'd been getting my colonoscopies every 5 years. That result came back with a lemon-sized tumor in my sigmoid colon. And when that was confirmed, he went into action, scheduled the oncologist, the radiologist. That then followed up with the meetings with the oncologist and the radiologist. And by, I think it was probably middle of March, we started on the radiology and the oncology program. Prior to that, Dr. McDevitt had put in a port so I'd do the 24/7 chemo, and then I did 6 weeks of radiology, 5 days a week. And then I had 6 weeks or so, 8 weeks of recovery. Dr. McDevitt did the surgery to remove what remained of the tumor. I had no symptoms before I had the colon cancer. I don't know about other people, but for me, it was a surprise. The only way you're going to know is to get the colonoscopy done. You definitely don't want colon cancer because it changes your bathroom habits. And my advice is get the colonoscopy based on your age, based on your family history. It's amazing. I've got friends who refuse to get a colonoscopy. It's 1 day versus 1 year of cancer treatment. So definitely you want to get it.
Well, good morning, and thank you so much for being with us this morning, Dr. McDevitt.
Good morning, Margot. Thanks for asking me to discuss this very important topic of colon cancer awareness here in March, Colon Cancer Awareness Month.
Great. Well, let's jump right in. Let's talk about colon cancer. What is it?
Colon cancer is an abnormal growth of cells in the colon. In our entire gastrointestinal tract, the cells are always being repopulated. Old cells die and are shed, and new cells replace those. Colon cancer arises in an error in growth of these new cells that are replacing the lining tissue of the intestinal tract. Most commonly, cancers of the gastrointestinal tract arise in the colon because of exposure in the colon to toxins and carcinogenic substances, a lot of which we ingest based on diet. Interestingly enough, the American diet tends to be carcinogenic. We eat too much meat, we eat too much processed food, we eat too many things that, as they are eliminated through the colon, actually expose the cells to carcinogenic substances. What happens, though, is that you see an early change in those cells to form polyps. Polyps are small growths on the lining tissue of the colon of cells that are growing in an abnormal pattern. They're not necessarily abnormal cells, but they're growing in an abnormal pattern. Polyps have a tendency over time to evolve into abnormal cells, and those abnormal cells are the start of cancer.
I think it's important in these episodes to talk a little about numbers and statistics. Sure. Can you share some information, colon cancer by the numbers?
Sure, yeah. Colon cancer is a very common cancer for both men and women. A little more common in men than women. There's probably 4 men for every 3 women that develop colon cancer, so a little bit more common in men. It is the 3rd most common type of cancer, though, for women, following breast cancer and lung cancers, and the 3rd most common type of cancer for men, following lung cancer and prostate cancer. I always tell my patients the #1 risk factor for colon cancer is having a colon, so unfortunately we're all at risk. It does tend to have an age pattern, though. Interestingly enough, you can have very young people with colon cancer, extremely rare. I've had patients as young as 23 with colon cancer. I've more commonly encountered patients in the 50, 60, 70, 80-year-old age range. And you can see, nationally, statistically speaking, with every decade of age, your risk does increase pretty substantially at the age of 50. And that's why, in terms of screening, the majority of people are recommended to begin screening colonoscopies or another screening modality for colon polyps and colon cancers at the age of 50. As far as in our particular area, Shelby County actually has an incidence of about 38 per 100,000 population per year of new cases of colon cancer. That equates to about 20 to 25 new cases per year. We have actually anywhere between 10 to 12 people per year that die of colon cancer in Shelby County.
Colon cancer is termed as the silent killer. Can you share some signs and symptoms with our viewers?
Yes, Margot, and that's a very good point, because unfortunately colon cancer gets started and it doesn't make itself present, doesn't give you problems until it gets fairly far along. The things that you need to look out for are blood in the stool, that's #1. Anemia, unexplained anemia. We see quite a number of patients that come in who have low blood counts for not a known reason and end up having tumors of the colon, which are slowly losing blood. Change in the bowel movements, in particular persistent constipation or diarrhea. A feeling that you have to have a bowel movement, but there's not anything there. That is actually a symptom that's called obstipation. And there's a constant feeling of having to have a bowel movement, but there's no real stool there. And the other thing is pain with bowel movements. That's a very important symptom to be noted as well. Pain with colon cancer tends to be unusual and a very late sign. So you've sort of missed the opportunity to treat the tumor early. The vast majority of people who have colon cancer won't have much in the way of symptoms. I have a story of colon cancer in my family. My father had colon cancer not once but twice, and he was originally diagnosed on the basis of being anemic. My mother actually insisted that he get something done because in the middle of the summer he was busy pulling on sweaters and heavy blankets and complaining about how cold he was in the middle of August, and didn't make a whole lot of sense to her. So she insisted that he get tested, and it found out he was anemic and had a tumor that was slowly but surely leaking blood.
Wow. Great information, great information. I know I'm sitting here thinking, okay, do I know someone or even myself? This is all just such great information to know when it comes to colon cancer and prevention and education. So thanks for sharing. Let's talk colonoscopies. Let's debug the myths that are out there when it comes to colonoscopy screenings.
Sure. Colonoscopies actually first started being done in the early 1970s. The development of the flexible technology for colonoscopies allowed the entire colon to be examined. Keys to a good colonoscopy are making sure that the colon is cleaned out, all of the stool burden is removed from the colon, and that's probably one of the biggest impediments that people encounter with colonoscopy is they have some concerns about what's called bowel prep, about cleaning out the bowel. And a combination of laxatives. Different formulas are used. We have different choices for people depending on what they feel like they can tolerate. It ranges all the way from a large volume prep, which is almost a gallon worth of material to drink, to smaller volumes, which are more common, split dosing prep, where you take half in the evening, half very early in the morning to clear out the colon, again accompanied by drinking a good amount of fluids. And we even have tablet preps. The procedure itself is something that is not uncomfortable. We like to use our anesthesia colleagues to make sure that people have a good experience. One of the things I found, Margot, is that if people are uncomfortable with colonoscopy, they won't do it again. The most common thing that we see with people is they have a little crampy pain from the gas or air that's used to inflate the colon. As you can imagine, to be able to actually get a good examination of the lining tissue of the colon, you have to put air or gas into the colon so that it's expanded, sort of like a balloon, because we need to look at that lining tissue for the polyps. And although it's called colon cancer screening, really I don't want to find colon cancers. What I want to do is find the polyps. Because with colonoscopy, you have the opportunity to remove the polyps when they're small. And when they're small, they won't have cancer in them, and you can actually prevent colon cancer. In fact, statistically speaking, if you have colonoscopy and it either has no polyps or polyps are removed, you decrease your risk of colon cancer by 80 to 85%, so very significantly. And as more people get colon cancer screening or colon polyp removal, you actually see an overall effect on the population in terms of decrease in new colon cancers.
If there's one piece of information that you can leave our viewers with today, what would that be in terms of colon cancer?
Unfortunately, colon cancer is quite common for both men and women. And in our community, it would behoove us to improve our rates of colon cancer screening to be able to decrease the number of people being diagnosed with colon cancer as a new onset. The key to that is finding and removing polyps. That will not eliminate all colon cancers, but you can decrease theoretically the new cases of colon cancer by about 80% by doing that.
Thank you for watching this episode of Wake Up with Wilson. Join us next month where we will sit down with sleep experts from Wilson Health to discuss the importance of a good night's rest and what it means to not only your physical health, but your mental health as well.